Let's talk about the prostate.
So the prostate is an organ that's located just underneath the bladder. So here's the bladder, here's the prostate, and all men have one. It is a sexual organ, so it secretes about 99% of the ejaculate volume, and about 1% is the sperm, and the sperm kind of meets at this place called the seminal vesicle, and the sperm is excreted with the ejaculate. But about 99% of the fluid that you ejaculate is carrier fluid that's secreted by the prostate. Now what happens is once you kind of hit the age of 40 and onwards, if it's in your genetic cards, a couple of things can happen. One is the prostate can kind of continue to grow, okay? And as it grows, it basically compresses the urinary tube that kind of goes right down the middle. The other thing that can happen as you age is the prostate can turn cancerous, and then those are other issues that we kind of deal with in terms of screening for prostate cancer with prostate exams and annual PSAs. But again, these are the main things that can happen to the prostate as you age.
What are some of the symptoms of an enlarged prostate?
So some of the symptoms of an enlarged prostate include pushing and straining to urinate, urgency and frequency to urinate, a slow stream, urinary dribbling, getting up at night to urinate. So a lot of those things can happen with an enlarging prostate. And typically they'll start around the age of 40 to 50. Not everyone develops them. Some people may just have some mild symptoms. Getting up once a night is probably average for about a 70-year-old or so. But again, if your father had an enlarged prostate, a grandfather, a brother, there's a chance that as a man, you may experience enlarged prostate and those symptoms as well.
Okay. So how would you manage the enlarged prostate?
So a couple of things. So I would say in terms of enlarged prostate, there is a mild enlargement of the prostate, there's a medium enlargement of the prostate, and then there's severe enlargement of the prostate. So when it's mild, a lot of people drink a lot of Cokes, coffees, teas, things like that, or drink a lot of fluids right before they go to sleep at night. So I would say quit that, or hey, instead of having 4 or 5 cups of coffee, how about just one? So kind of do some lifestyle or dietary changes. Some people find that kind of taking some saw palmetto or over-the-counter supplements can help for mild issues with enlarged prostate. For people that have mild to more moderate symptoms in terms of pushing or straining to urinate, decreased flow, things like that, then I might suggest maybe taking an alpha blocker. That could be a Flomax, a Uroxetrol, tamsulosin. There's a couple different medications in that class. And what those medications do is that they basically relax the prostate a little bit so you can urinate better. So that's what's happening. If you forget a pill, if you don't take it on a nightly basis, you'll have recurring symptoms the very next day. So the alpha blocker class of medications can be helpful. All medicines have risks and benefits associated with them. And in terms of the risks of the alpha blocker class of medications, they do cause potentially a slight decrease in blood pressure. So some people may notice that they have some, dizziness first thing in the morning, that type of sensation. Some people may get a stuffy nose because it's vasodilating the vessels in the nose. Some people may, discuss with you, hey, I've got some issues with decreased ejaculate volume or decreased sensation of ejaculate. So sometimes you can see those as a negative side effect. So those were, the options for mild and moderate BPH. People with more severe enlarged prostate or a really enlarged prostate may require some sort of surgical management. Typically, there has been something called a TURP performed, which is transurethral resection of the prostate. So what we do is under anesthesia, we go up the urethra and we unobstruct or remove a lot of the obstructing tissue within the prostate, the TURP. The only issue with the TURP is that it works exceedingly well, but you may notice a decrease or a lack of ejaculate afterwards. What happens is this prostate is so wide open, some of that ejaculate fluid after intercourse can actually hiccup directly into the bladder, and then you pee it out afterwards. So, so it's called retrograde ejaculation. For a lot of people, that may not be a big issue. For some people, it can be a little disturbing. So that's the TURP. Finally, for people with really, really enlarged prostates, there is something called a simple prostatectomy, where we can robotically open up the bladder and actually remove a lot of that prostatic tissue physically. And then finally, there is this other procedure called the holmium laser enucleation of the prostate, or HOLEP procedure, which we'll cover separately. And then finally, last but not least, is something called the Urolift procedure. That is something that we also perform here at Austin Urology.